So good afternoon, everyone. Today we are going for the handling and sample of linens and everything we are seeing. So we have this topic will ask for what are unhygienic movements and unhygienic durations. So how long we can do hand wash and the surgical hand wash and all we can. That is two more question it will be asked. Okay. So hand hygienic. So why we are using hand hygienic? So mainly we have any microorganism or any dirty anything is there means that one we can cleaning purpose we are using that hand hygienic. So here we are sometimes some infection material also it will be spread to the one organism to another organism. So that's why we are using that hand washing. Then hand wash most of hand wash otherwise we can do some sterilization also or hand scrub we can do it anything, so it can be removed for 30 seconds it will take. So we can use for the liquid or any soap we can use it, we can remove that microorganism. So hand wash it will take for 30 seconds. Okay. Then we are using that five steps of hand hygienic. So upcoming pages you can see that five steps of hand wash and movements and everything. Then we can go for that. What are the benefit we are getting hand hygiene? So for creating safe working environment to the patients, then prevent any diarrhea or intestinal disease and all we can preventing. Then avoidance of the common eye infections and all. Then obstruction of the respiratory tract infections and all we are reducing. Then we can go for that hand hygienic movements. So hand hygienic movements is important to the who are working and field to the medicals. So whenever we are using that and hygienic movements, first before touch a patient. So whenever we are before touching the patient we are using that and hygienic because it should not carry for the one organism to another organism to the patients. Then we go for the any otherwise we can doing any sterile technique also we are doing that one. Then before cleaning aseptic procedure. So aseptic procedure means if you are going to installation of the IV or any IV line or any catheters or doing some dressings, so that time and all we are doing that hand wash. Then after body fluid expose. So once we are fixed with the IV lines, so that time fixed and everything doing. So that time if you are any blood touching anything happen also, it's high risk. So that time also we are doing that hand hygiene. Then we can go for that after touching the patient. One done the every procedure or anything completed in the bedside. So then we are informing to the patient side. So that time we are doing that after and hygienics. Then we are going then once come out to the patient environment. So after touching the patient surroundings. So that's once come out in the room, cubic or any ward, you can coming out now. So that time also we are using that and hygienic techniques. Then what are hand wash procedure? How to we can do it? So hand wash always will take for the 40 to 60, but this and just a sterile liquid if you are taking means 20 to 30 seconds is enough to scrubbing. Then first we can first wet the hand in water, then apply then pour the 5 ml of any liquid or soap anything and rub it. So then right over to the dorsum, left over to the right arm dorsum. Then palm to palm fingers interlaced, then back to fingers of oppositing with the interlocked, then rotational rubbing backward and forward to the clutching methods, then rinse the water and dry the hand. So use the towel to turn off diffuse it and use safe method. Then hand care always will be any cream, any oil, any lotion we can apply it. So don't touch any washing area or anything immediately to the alcohol based means. So if you're using also you should not alcohol means don't again to wash to water and all. So if you want you can use for in different situation and hand wash or otherwise scrubbing anything we can use it. Then this is the method of hand wash. So we are doing that first pour the water, then take the liquids, then the left to right, then right to left, then interlocked, then finger tips, then rotational, then rubbing into the middle of the palm. So then we can wash with water. So this is the methods you should always know about. Then PPE. So PPE is the personal protective equipment. So mainly that personal protective equipment, what are the things we are using? Clothing, helmets, gloves and face shields, goggles, face mask or respiratory or any design product we can use. Then when is used for properly means any infection materials or skin or mouth, any eye. So sometimes mucous membrane and all, it will be transition to the block the transmissions. So that time any body fluid or anything it will be spill means that time we are using this one. So what are the types of protective equipments will be there? First gloves. So always first wear the your gloves. So protect your hands first. Then we can free germs for the hands. Then healthy worker to different types of according to the performing of the procedures. Then mask is mainly will cover the nose and mouth. So it will be help to germs to nose and mouth with the spreading also. But sometimes sneezing or anything also it will be spread. So that the respiratory tract infection. So that should be avoided. We are using. Then face shield. So face shield normally we are using for that spillage won't be occur. So that's why we are using high spillage, also high any conjunctivitis and all, we should not spread. So we are using that one. Then protective clothings we have it covering our goggles, so shoe covers and all we can using. So we protect to the against to the infections. Then always we should choose the right PPE. So so when should wear your PPE? So any doing some touching any blood and body fluids means that time any respiratory tract any infection before doing any procedures. Then if you are cleaning any spillage, so that time and all we should use that this PPE. Then when are the gloves are not required? So basic procedure we require this one. Otherwise taking some recording or anything means that time also we don't want to do that one. Any sections also we don't want that one. Then when should gloves should be changed? Any dirty, it will be any blood stain or any body fluid means immediately you should change your gloves. Then this is the plastic aprons. So we have plastic aprons offset. Then a full body is also is there. Then we have surgical gowns also we have. So mainly that plastic apron, any disposable of the biomedical wastes, any spillage that time and all we can using that plastic aprons. Full body means we can use for the ICUs. Then we have going for the operation that answer full we can use. Then high-end face protection we can use the like this type of goggles or facial we can use. Then mask means we can use normally face mask or surgical mask we can use it. Then surgical cap also is must to use. So because sometimes the hair or skin scalp or any bacteria it's there means it will be spread. So that's why. Then we can use for the shoe covers. So mainly how to clean the trolleys and vehicles in hospitals. So first the wheels and all means we can clean for the every sanitizer or any if you're lock and we can keep sanitizer. So like this and all we can give elevation. Sometimes beds should be raised for the head and foot and all. So that time we are using. Then we have the trolley, stretcher, wheelchair, instrument dressing. So everything we are using for the different kind of procedure. In necessary time we are using. So how to we can clean it? So always disinfection solution we can use for that chloride 2% of ethyl oxide, then intermediate level of infection it will be prevent any this always it will be alcohol contaminated you should use. Then only that trolleys and wheelchair instrument stretcher and all we can clean it properly we can cornice, then we can clean it. So mainly we have any dirt is also sometimes blood spillage or body fluid spillage also we can clean it. So mainly we have that reducing the hospitals articles and all, it will be should be sterilization method and all should be follow it. So that's why according to hospital protocols we are doing. Then always when you are doing any procedure, proper PPE is a must. If you are damaged any articles means you can inform to supervisor and we can take out. Then we have regularly we can check that surfaces or instruments. So everything we need to check. It will be contaminated, immediately we should change. Then all the procedure means proper disposable PPE should be done. Okay, then you have any injury or any disinfections, anything means must needed stick injuries, anything means must should be informed to that your supervisor. Then any patient have TB or HIV means we should always protect to the airborne infections. Okay, so how to patient linen under should be recommended. So bed linen under should be 2 days once. We should always clean. If you are a salt for any blood and body fluids, you can remove it. Then patient count should be changed for every day. Then we have any dirty also we can give to the laundry wash. Then we have any body fluid should be packed to the leak proof, anything you should not keep. Then what are the principles of processing? So you should wear gloves, other PPEs means collecting, handling, transporting, and every time we should use it. Then we have the transport linen bundle and all we should use for minimum collect to avoid accidental injuries. Then we have any surgical crabs and grounds and all we should use. Then if you are all carried solid linen and all you should tie it and use for the contaminated of fluid it will be touched and all we should label it and we can cover it properly. Then we can do the transport. Then after everything then come and wash your hands. So always this we should do it. Then what are the processing of linen will be there means first drying and checking unfolding linen. So step means completely hair or machine dry it's must. So always you can keep for the sunlights. Then we have different fabric. Then second is all the linen should be dry and check any holes or any threads is there and all we should check. If you have anything you can discard it, otherwise repaired. Then we have that any some changes anything in the lab sheets and anything means we should always wrap it 5 patches or when 20% of wrap you should will do it and keep for that sterilization method. Then third it's a clean and dry linen should be ironed and needed for the folded. Then only it will be patients also will be comfortable. So always we can use this one method and all we can do it. So here we will ask for the questions is um, mainly hand wash and hand wash movements. Okay. So thank you to all.